Welcome to Coding Clinic Update, third quarter 2016. Sepsis coding issues. AHA's central office has received a number of inquiries about how to appropriately code the condition of viral sepsis, and the following guidelines have been developed to help coders correctly report viral sepsis, primarily because there is no distinct code by which we can report viral sepsis at this time. Advice given to us is that for the diagnosis of viral sepsis, we should assign code A41.89. There is a discussion in Coding Clinic that talks about, although there is no specific code with which to report viral sepsis, A41.89 is the best available option, and these are the instructions given to us by the cooperating parties. Instructions also include to add code B97.89, other viral agents, and a code from R65.2, severe sepsis, would not be assigned unless severe viral sepsis is documented in the medical record. To restate the previous slide more succinctly, the codes that we would report for the diagnosis of viral sepsis are as follows. A41.89 to identify the other specified type of sepsis, the B97.89 to identify that this is a viral sepsis, and if documented, to report either R65.20 or R65.21, severe sepsis with or without sepsis shock, depending on the circumstances. Today we're going to talk about a number of viral sepsis issues. There are 13 questions in this issue of Coding Clinic pertaining to viral sepsis. We're going to use a much shorter list to emphasize the most prominent questions that you might encounter in your daily work. That of viral sepsis, sepsis secondary to viral syndrome, influenza with sepsis and pneumonia, and acute respiratory failure. So let's have a look. The very first question: how would viral sepsis be coded in ICD-10? And the answer is, as we discussed previously, A41.89, other specified sepsis, and B97.89, other viral agents as the cause of diseases elsewhere classified, to help us identify the organism as being a virus, because A41.89, as you know, is other specified sepsis and not specifically a code for a viral sepsis. Next, sepsis secondary to viral syndrome. How would a diagnosis of sepsis secondary to viral syndrome be coded? And again, we have A41.89, other viral sepsis for the viral sepsis, along with the code B34.9, viral infection. And in this case, we're using B34.9 rather than B97.89 because viral syndrome is specifically coded and indexed to B34.9. Sepsis due to acute viral bronchitis due to influenza A. And the question posed is, what are the correct ICD-10-CM codes for a provider's diagnostic statement of viral sepsis due to acute viral bronchitis due to influenza A? And the instructions are very specific. Assign code A41.89, as we've learned previously, for other specified sepsis. The Coding Clinic goes on to tell us that although codes A30 through A49 classify bacterial illness, because there's no specific code for viral sepsis, A41.89 is the best available option to capture this condition. You would also assign code J10.1, influenza due to other identified influenza virus with other respiratory manifestations. And the other respiratory manifestation reflects the presence of the acute viral bronchitis. And we would use code J20.8 to specify what the respiratory infection is specifically. The last paragraph on the page is very interesting. Codes from subcategory J09.X, influenza due to identified novel influenza A virus, are intended for a specific strain of influenza A, such as novel influenza A, and not the ordinary seasonal influenza A that's being described in the question. Because this is such an important concept, earlier this year on the Libman Education website, a blog was posted reminding us the right way to do this. Now that flu season is approaching, I'd like to offer a reminder as to how to code the flu, and a reminder that influenza A is not the same as novel influenza A. Influenza A is just regular old influenza encoded to J10 or J11, and that novel influenza A is coded to J09 as pointed out in the coding clinic. And novel influenza A is H1N1 virus or the H5N1 virus, which are both animal-borne influenzas, of which seasonal influenza is not the same type of influenza. And just a reminder to use caution when looking these up in the index and assigning codes for influenza. Sepsis from influenza with pneumonia. Question posed is, how do you code a patient who is admitted with sepsis from influenza with pneumonia? And it says assign code A41.89, as you would expect from the series of questions that you've seen so far. We have the standard language, although there is no specific code for viral sepsis. This is the best option, and you will see this repeated in every question because each of these questions needs to stand alone. In the event that you're searching for answers to your very specific question, this language needs to appear in each question. In addition, assign code J11.00 influenza due to unidentified influenza virus with unspecified type of pneumonia for the influenza with pneumonia. So first you assign a code A41.89 for the viral sepsis, and secondly you assign a code for influenza with pneumonia to completely describe the circumstances of the clinical condition that you're trying to report. The official coding guidelines support the answer to the previous question of how to code sepsis and severe sepsis with a localized infection. If the reason for admission is both sepsis or severe sepsis and a localized infection such as pneumonia or cellulitis, a code for the underlying systemic infection should be assigned first. So there's a sequencing requirement, and the code for the localized infection, in the case of the previous question, the pneumonia, should be assigned as a secondary diagnosis. So to review, systemic infection is sequenced first, the sepsis, and the localized infection, the pneumonia, would be sequenced second. Sepsis due to Lyme disease. All the questions in this range pertain to sepsis due to a viral illness, but you're quick to realize that Lyme disease is not a viral illness. Lyme disease is a bacterial illness caused by the bacteria Borrelia. And here we have the question, how should sepsis due to Lyme disease be coded? Standard answer, assign A41.89, other specified sepsis. And this is where you realize that this code, if you've not realized it already, is a catch-all code for all of the sepsis for which there is not a specific sepsis code. Viral sepsis is classified to A41.89, and so would sepsis due to Lyme disease. Standard language, A41.89 is the best option. And then we're given the instruction at the end to assign also code A69.29, other conditions associated with Lyme disease. Worth noting that the instructions don't tell us to code as a secondary diagnosis Lyme disease, A69.20, but in fact A69.29, other conditions associated with Lyme disease, meaning the sepsis. Acute respiratory failure due to severe viral sepsis. The question is, how should acute respiratory failure due to severe viral sepsis be coded? And the answer below, as you see, gives us 4 codes as the answer. They are as follows: A41.89, as you might expect for the diagnosis of viral sepsis, as well as B97.89 to identify the virus as the cause of the sepsis. Additionally, we would use code R65.20, severe sepsis without septic shock, and the code J9600 to represent the documented acute respiratory failure. We use code R65.20 to identify the severe sepsis because the definition of severe sepsis is Sepsis with acute organ dysfunction, and the acute organ dysfunction is taking the form of the acute respiratory failure. The previous question and the answer are consistent with the official coding guidelines as to how to report severe sepsis. The coding of severe sepsis requires a minimum of 2 codes. First, a code for the underlying systemic infection, the viral sepsis, A41.89, followed by code from category R65.2, severe sepsis. If the causal organism is not documented, assign code A41.9, sepsis unspecified, but here we know that it's a viral sepsis, so we would use, in our example, our question A41.89, and the additional code for the associated acute organ dysfunction, the respiratory failure. So you can see that this coding clinic answer to respiratory failure due to viral sepsis is being answered consistent with the official coding guidelines. If you have any questions about this coding clinic or other coding clinics, please feel free to contact me.